Hi, I'm Dr. Penn from Horizon Animal Hospital. Today I'm going to talk to you about anesthesia in dogs. My assistant and lead technician, JJ, is going to ask me some questions so that we can better understand the process.
Okay, Dr. Penn, when would my dog need anesthesia?
Well, anesthesia is needed anytime there's a procedure that might need to undergo some discomfort. Because by definition, anesthesia means without pain and also taking away the awareness of the procedure with general anesthesia.
And what are the different parts of anesthesia?
So there are different types of anesthesia. They come in general anesthesia, as I just mentioned, is when the animal is completely unconscious. There's also local anesthesia, which is, by true definition, completely eliminates any kind of pain by blocking the pain receptors. There's also sedation, just sedation, where they're not completely unconscious, but they also do have some pain control that's provided, as well as they're immobilized somewhat so that we can do the procedures on them.
Are there any particular dog breeds that are more sensitive to anesthesia?
So this question comes up quite a bit. There are certain breeds, what we call brachycephalic animals. So these are bulldogs, boxers, shih tzus, Pekingese, French bulldogs. All the animals that have their faces are smashed. They have some airway issues that we have to be particularly cautious and careful with.
So what do I need to know before my dog goes for an anesthetic procedure?
One thing that's important to understand is that anesthesia is really safe. I like to commonly tell people that driving in the car to get to the veterinary hospital carries greater risk than anesthesia. Although the risk is not zero, there are some things that we do to get prepared for anesthesia.
And what things do you prepare?
So one of the things that we do is we want to make sure that there's no food in the stomach during the procedure. So for planned general anesthesia, we recommend an overnight fast with food. And with anesthesia, we also want to make sure that their liver function is good, their kidney function is good, and that they do not have any breathing difficulties or heart disease that's not managed.
What are some possible complications of anesthesia that my dog could experience?
Well, with any medication, there's always a potential for an adverse drug reaction. But fortunately, that's very uncommon. We do have full monitoring. We utilize EKGs, pulse oximetry to monitor the oxygenation. We check their blood pressure. We maintain IV catheterization so that we have immediate venous access and to give emergency drugs in case that there are any complications, be it how rare they are.
What monitoring will be done by the veterinarian to ensure my dog is safe while undergoing anesthesia?
So monitoring is continuous when we do anesthesia. We are constantly monitoring their heart rate, respiration, blood pressure, anesthetic depth. We are trained to monitor the depth of anesthesia based on certain parameters such as eye position, jaw tone, reaction to certain stimuli. So all of these things are utilized to monitor the safety of anesthesia.
What do I need to watch for at home after my dog has undergone anesthesia?
So with anesthesia, there can be some residual sedation so we try to make sure that dogs are not allowed on, slippery surfaces or stairs or anything until they're completely awake. Most of the time when the animal goes home, they're adequately awake to go ahead and live their normal life. Sometimes their appetite is a little bit decreased within the first 24 hours after a procedure. And of course, this passes typically in a day.